My name's Emily. I'm from the infant feeding team at Croydon University Hospital. So at Croydon University, we have an infant feeding team. There's 4 of us that work with the inpatients, and we cover pretty much the whole week, so 24-hour service. We're here day and night to support with infant feeding, whether that be breastfeeding or bottle feeding, we're here to support. We also have a community infant feeding team, and they run lots of drop-ins across the borough, so from the north of Croydon right down to the south of Croydon, and they span the whole week as well, with lots of drop-ins available to support once you get home. They also can offer home visits as well, so if it's difficult for any reason for you to get to one of the drop-ins, which are usually run at children's centres, they can do home visits as well. The community team also run an antenatal class all about breastfeeding and infant feeding, and that is run on a Wednesday morning, and you can book into that, so speak to your midwife when you have midwife appointments. Breastfeeding your baby can reduce your baby's risk of developing obesity later on in life, as well as type 1 and type 2 diabetes. It can also reduce the breastfeeding parents' risk of certain cancers as well, such as ovarian cancer and breast cancer. So when baby is first born, you produce colostrum, which is baby's first milk. And that is full of lots of good bacteria, it's full of stem cells, proteins, carbohydrates, lots of good things for your baby to start your baby off in the first couple of days. And then typically around day 3 is when your milk transitions from colostrum to mature milk. Colostrum has a very thick consistency. It's often golden or yellowy in colour. Colostrum is everything that your baby needs in the first few days of life until your milk transitions from colostrum to mature milk. Typically this happens on day 3, but it may happen on day 2 or day 4. Sometimes during that transition period, some people might find that their breasts feel heavier and fuller, but this doesn't happen for everybody. Doesn't necessarily mean that your milk isn't transitioning, just everybody's bodies are different and things happen at different times. Breastfeeding can reduce the parent's risk of osteoporosis as well as cardiovascular disease. And for baby, breastfeeding can decrease the risk of SIDS, sudden infant death syndrome, as well as baby's risk of asthma and certain cancers. It can also reduce the risk of obesity later in life and can reduce the risk of certain allergies for baby as well. Breastfeeding can also help to support with bonding with baby. It can reduce the parent's risk of developing postnatal depression. Breast milk offers protection to your baby. It adapts to your baby's needs. So it adapts to the environment that you're in, and it changes according to what baby needs, and it protects baby from infections. It also supports baby's gut health. Colostrum, baby's first milk, is also a natural laxative, and it supports baby to get their first poo, meconium, out of their body. The NHS and World Health Organization recommend breastfeeding your baby up to 2 years and beyond, and exclusively within the first 6 months. As an infant feeding team, we're here to support all families, whether you decide to exclusively breastfeed, to combination feed or to formula feed. Informed is best. There are lots of different ways to feed your baby and hold your baby. When feeding your baby, typically the most common way that is used to feed newborn babies is cross-cradle position. So that is where you are using the opposite arm to the breast that you are feeding from. You're placing your hand behind baby's neck, not behind baby's head. Behind baby's neck, using your forearm to support baby's weight, and bringing your baby up to the breast. Leading with baby's chin first, so that baby gets a nice big mouthful of breast tissue. Ideally, you want baby to have lots of breast in their mouth, not just nipple. If baby just has nipple in their mouth, it's going to be painful and it's going to pinch. Ideally, you're looking to get lots of breast tissue into baby's mouth so that they can bring down more milk and it will be much more comfortable for you. One of the other more common ways to feed a newborn baby is rugby hold position. So that is where you are supporting baby with the same arm to the side that you are feeding from. You're again placing your hand behind baby's neck, not behind baby's head, and tucking baby right under your arm, supporting with your forearm. Baby's feet will be at the back of the chair or the bed, wherever you may be. And again, you are bringing baby up to the breast. Don't bring your breast to baby. If you start bringing your breast to baby, you're going to get bad shoulders and a bad back. So ensuring that you're bringing baby up to the breast, and again leading with the chin so that baby can take a nice big mouthful of breast tissue. One of the other common ways to feed a newborn baby is the cradle position. So that's where you're supporting baby with the same arm to the side that you're feeding from, and you're bringing baby again up to the breast, waiting for baby's big wide open mouth. And to encourage baby to open wide, you can run your nipple across baby's top lip to encourage baby to open up wide, and then again bringing baby up to the breast. If breastfeeding is painful, if it's pinching or sore, then please seek support. If you're an inpatient, from the inpatient team, or if you're in the community, contacting the community team or attending one of the drop-ins available. There are lots of other ways to feed your baby and lots of other positions, but these 3 ways is the most typical way to feed a newborn baby. Hand expressing can be a useful tool both antenatally and postnatally. Antenatally after 36 weeks gestation. It's good to learn how to do if you need to hand express antenatally for your baby, or postnatally if baby's struggling to latch for whatever reason. It can be helpful to have some colostrum for baby, just so that we know that baby's getting something. So in order to hand express, the first thing that you would do is wash your hands. You can get syringes and you can ask your midwives for these syringes. And these are 1 ml syringes. It's important to note that any amount of colostrum for baby is a good amount of colostrum. So don't worry if you don't fill up a whole syringe. Any amount of colostrum is a good amount. When you come to hand express, first of all, wash your hands, and then you want to stimulate the breast. So you can use your knuckles very gently, just running them down the breast. You're not doing this hard, you're not pushing, you're just very, very gently stimulating the breast. Also placing your hands either side and just again some very, very gentle stimulation. When you actually come to hand express, you're using a C shape with your thumb and your index finger. You're making sure that your thumb, your nipple and your index finger are in a straight line. Move back approximately 1 inch, 2.5 centimeters back from the base of the nipple. This varies depending on the individual. And then you are compressing and releasing and compressing and releasing. You will slowly start to see some glistening or maybe some drops of colostrum. And then the syringes, most of them have a wide opening, so you can collect and then pull down and collect. If you feel that you've exhausted this area, you can then move down. Think of the breast as a clock face. So you can do 12 and 6, 9 and 3, and move around to get as much colostrum as you can for baby. Once you have collected some colostrum, you can store this in the freezer until you're ready to come into hospital and deliver baby. And you can ask the team to support you with syringe feeding baby your colostrum if that is necessary.
Hi, I'm Amy Jones.
Hi, I'm Sarah Lawler.
And we're part of the community infant feeding team for Croydon.
We support women once they've left the hospital, in the community, in various locations, so in their own homes if need be, in the drop-in centres, children's centres and family hubs. Once you are discharged from hospital, you require further support, you will see myself, Amy or Emma at any of the drop-ins. So the drop-in centres, we try to keep them as informal as we can. We ensure that there is privacy if need be.
Privacy screens for women that may not feel as comfortable feeding in an open space.
Once we've identified what the feeding support is that you need, we will then decide whether or not you need to be seen at home. So in your own environment, where you're able to use your own feeding pillows, your own sofa, chairs, wherever you like to feed baby.
So once you've had your baby, if you require further support, we do extend our services to home visits in special circumstances. Sometimes we get referrals from specialist teams and we can see you in the comfort of your own home. So when you come to our drop-in sessions, we welcome all families and all children to come along at the sessions. We offer refreshments and a space for the toddlers to be able to play while mum is getting the feeding support that she requires. We also have shields and curtains that if you felt comfortable feeding behind the curtain and not in an open room, that is accessible for you. We also are very supported by the Family Hubs, Woodlands Children's Centre specifically. They have an amazing infant feeding room, and we hope to have more of those available soon for women to come and feed in the room and feel safe and feel secure, and also feel that they have the right support by us.
Once a week at the moment on a Wednesday morning in Thornton Heath Library, we're supported by the Family Hubs Outreach Centre. We provide antenatal classes to support women with all aspects of feeding. We concentrate on things like the benefits of breastfeeding,
Position and attachment. And we also get you to demonstrate how to do position and attachment with your baby with a doll, so you can get the feel of how that feels before your baby arrives. We also cover safe sleep as well, and all the aspects around how to give you the most information so you're able to make an informed choice about how you'd like to feed your baby. So one of the topics that we cover in our antenatal feeding sessions is building bonds with baby and having that close, loving relationship with baby, stroking your bump, singing to baby, talking to baby so baby's familiar with your sounds when baby comes into the world.